On this episode of Plastic Surgery Uncensored, I'm super excited. We're going to be doing a Q&A session. Every so often, I love to open it up to question and answers, and we're going to go through all of your questions and try to give you answers that are going to be exciting and educational. So make sure you tune in to the entirety of this session. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. I am accompanied by Maria, our wonderful producer, located in Miami, sexy hot Miami, while I'm sitting here in LA.
Really hot Miami.
Hot Miami. And we're going to be doing another episode of Plastic Surgery Uncensored. This one is going to be a Q&A. Every so often we get a bunch of questions sent in via Instagram or other platforms, and I want to be able to dive in and give you my thoughts and answers to your questions. We're also going to start out with just giving I'm just going to give you a little bit of my thoughts regarding COVID. Obviously, COVID-19 has not only impacted, it has just basically impacted everything, every aspect of everyone's life in every fashion, and plastic surgery is no different. I'm going to tell you sort of what are the things that we're doing and what you can expect, and then we'll dive into some of your questions. So when it comes to COVID, the first thing I'm going to tell you is that no one knows anything. I don't know anything. No one knows anything. Dr. Fauci doesn't know anything. The government doesn't know anything. Everything that we're doing is on the fly. This is unprecedented. No one's ever seen this before. And if you've noticed, and what's partly frightening and somewhat frustrating, is that one thing that's working one week is not working the next week. And so what's frustrating as a community is that we turn to government and medical for guidance in these kinds of environments. And when we're not getting consistent responses, it makes us frustrated and, more importantly, scared. I have no magic answers for anybody. I can just tell you the following things. COVID-19 is a real virus. It is killing people. It is not only killing people that are predisposed to having pre-existing conditions, although it is mostly affecting those people. If you're young and healthy, you should be concerned and you should take precautions. At the same time, I do not think COVID-19 is going to wipe out the human race, and I do not think that we need to be in a state of panic or over-dramatize this. I think the problem that we're having is that you're either on one end or the other, and like most things, when you're that way, it doesn't work. On one end, people are panicked, they're in severe isolation, they're not touching things, they're going nuts, and they're getting batty. And when you get that way, you get nervous and anxious and affects your mood. I know somebody killed themselves. All that, I think, in my opinion, is overkill. Conversely,
they killed themselves. You said
somebody committed suicide.
Because they were panicking?
No, because they were in isolation and they got so depressed from not having contact that they killed themselves.
Wow.
Yeah, that was in the news, and it was actually a famous person. The other side of it is this is all nonsense. This is all a conspiracy. All those dead bodies are not really dead. I don't need a mask. What do I need a mask for? And so you run around and you are just causing chaos. And as a result, now we're having another spike, and people who were rioting and picketing and protesting, all for the protests, obviously not for the riots. Half of them were doing it without masks, and now we have a spike. So the answer is middle ground. Wear the damn masks. Wash your hands. Don't stick it in your face, eyes, or your mouth. Stay clear from other people in large gatherings, and take normal precautions. And if you're feeling crappy, stay away from people. And it's not rocket science. It's the exact same thing that was working that we stopped doing that we need to be doing. So when it comes to plastic surgery, I actually think, what are the precautions we're taking? Our lobbies are empty. People wait in the cars. We text them. There's only 1% of the time that comes and goes. The staff has all been tested for COVID. All the patients get pre-tested for COVID before any procedure. We wash and re-sterilize the instruments like we did before, clean the rooms. I mean, we're just super careful. And I think that for the most part, as I said, no one knows what works and doesn't. It seems to be working just fine. And in my personal opinion, that is more than enough in order to mitigate or lower the risks as long as people are doing their other parts. So just stay calm and let's ride this wave and just do your part. Wear the damn mask.
Are people able to get plastic surgery during this time? Is it something?
Yeah, I mean, we've had a ton of people get plastic surgery this time.
You're trying to make up for the time that you weren't able. You're trying to make up for the time that you weren't able to.
Well, I mean, listen, they stopped allowing people to do elective surgery not because it was dangerous. The reason they stopped people from doing
they didn't have the rooms.
because they needed the material for other places because they thought there was going to be suddenly like 10,000 people in a hospital. They weren't ready or knew what the surge was, so they made us stop. It wasn't because they were afraid that if you had surgery, you're going to get infected. As a matter of fact, it's so isolated and so sterile and everyone's wearing a mask that nothing happens. But now we're back and we're doing what we're doing, the precautions. Everyone gets tested to make sure that they're safe, the staff is safe, and then you go home and you recover for 2 weeks. It couldn't be any better, and you're wearing a mask. So no, I mean, I think that it's perfectly fine to be doing surgery, at least in my opinion, as long as you're taking the precautions.
Right.
All right, so let's dive in some Q&As. What do you got for me? So the good news is, what I like to do is I've never seen these questions, which then means that I'm not really prepared, which then means it's going to be really organic. So I may say a couple of things like, what? But read me the questions.
Okay, so let's go with Lauren Wallace.
Lauren Wallace, what's the question?
What should I expect when having breast reduction surgery before children and breastfeeding?
Okay, so the question was, what can I expect regarding breast reduction surgery in regards to breastfeeding before having kids? So a breast reduction is a process in which large pendulous breasts are made smaller and lifted. And I cannot tell you how many people send in requests saying, I want a breast reduction and I want a breast lift. Every single breast reduction is a simultaneous breast lift. The difference is in a breast lift, we remove no tissue. In a breast reduction, we remove tissue, but we do the same thing in both. So by definition, you're removing breast tissue. What's in the breast tissue? Milk ducts, milk glands. So you should expect, as a result of having a breast reduction, you will have impact on your ability to breastfeed. The question then becomes is how much and will I be able to breastfeed? And the next question is, well, how much should we reduce and how much milk were you going to make? So if you have a major breast reduction, really, really large breasts that are made small, you're going to remove a lot of gland, and as a result, your breast milk production when you get pregnant will be less. And if you have a smaller breast reduction, then it will be not as bad. The answer is no one knows whether or not you will be able to breastfeed if you get a breast reduction before you get pregnant. If it is a must, I must breastfeed my child, then do not get a breast reduction because you cannot guarantee you will. That's the answer.
Okay, then we have from Ad3SR. If there's enough tissue.
Ad3SR?
Yes.
All right, that's cool.
If there's enough tissue in a lift, can a surgeon use that to make volume? A lot of lifts look flat.
Great question.
Sometimes breasts look boxy after a lift. Okay,
great question. So the question was, if you come in for a breast lift and you have adequate tissue, can you use that as alone? So the question is a very appropriate one. So the bottom line is you want an attractive breast. Everyone looks in the mirror like, wow, those are so, looks in the photos and says, those are pretty, those are not pretty. So what makes it pretty? It makes it pretty because it has a pretty shape and has appropriate volume. You can have a pretty breast without enough volume. In other words, if it doesn't have volume, it can't have a pretty shape. So when you do a breast lift, in order for it to look good, you can't just lift it and not have volume. So if a woman comes in, and this is at the discretion of your surgeon, and has not enough breast tissue and you do a breast lift, you need to add volume in the form of an implant. If a woman comes in and has a lot of breast tissue, then I can do a lift without an implant and create volume. So who's to determine whether or not you need an implant or not? Your surgeon. That's why you go to an expert. They will determine whether or not you have sufficient breast tissue to create the upper pole fullness you will want, guaranteed, when it's done, with or without an implant. That's it.
Good. Okay, so here I have another question on breast reduction. Fairy Layla is asking, can I get a breast reduction lift and implants at the same time? I think you answered that, yes, right?
Well, there's a third category, which is interesting. These questions all came together. So the third category, so category 1 was big breast sagging breast reduction. Category 2 was pendulous breast without much breast tissue. You get a breast lift and an implant. And there's a third category, which is the most challenging and requires the most skill, is that you get a breast reduction, meaning you reduce some of the breast tissue, and then you add an implant, which is counterintuitive, which means like, wait a second, if I'm removing breast tissue, why the hell am I adding an implant? And the reason is that in some people, and this requires skill, the extra breast tissue they have is in the bottom half where it's heavy and they want the extra breast tissue on the top, and you can't just take the tissue and just stick it there. So you need to remove breast tissue in order to be able to have the space for an implant. That is a unique type of surgery, and that requires a decent amount of skill.
I did that.
Yeah, so you do a breast reduction and you get an implant, as opposed to you get a lift and an implant or just a breast reduction.
Yeah, because I remember when I went to do it several years back, I didn't want an implant, and the surgeon said, you have to have an implant when we lift it to create the fullness on top, and I think it worked, thankfully.
Yeah, so.
Okay, this woman says, I did another breast one. I did a breast augmentation 10 years ago. Do I have to replace them with new ones?
So breast implants are devices, light bulbs, timing belts, they're devices. And all devices have a longevity, and all devices eventually break. The question is when, and nobody knows. If you have saline implants, when, not if, when they break, you will know. It will be immediate. You will wake up and you'll be like, oh crap, what the hell happened? Within a day or two, one breast will completely deflate. And then you will go, oh, okay, I need to hurry up and get this fixed because one breast is full and one isn't. If you have silicone implants, you will not know immediately that the breast implant broke because it's a silent rupture. But both implants will eventually break. The goal is for you to replace the implants prior to them breaking. Much like the goal is to change your tires before you're driving on the freeway and they explode. Because when that happens, it's messy and annoying. Now, if your implants were to break, saline or silicone, you're not going to die. It's not dangerous. You're not going to, it's just annoying. It's a rush. Then you're in a state of panic, etc. So we suggest every 10 to 15 years, even if your breasts look great and you're super happy, that you make a small incision and you replace the implants. That surgery is nowhere near the same surgery that you originally had in terms of pain and discomfort and recovery. But that's what's currently suggested.
Okay. Here we have one, has no name, it has a whole bunch of numbers. What is a ponytail facelift?
So ponytail facelift is a super trendy, in the world of cosmetics, there is the classic and then there is the fad-driven world. We live in the world of Instagram and marketing and celebrities and influencers. So surgeons' number one goal is to get insta-famous. So they'll want to create something that they can label as their name and then promote it online so that people want that thing, even though that thing is the same thing that everybody else does, but they just called it something else. Like a facelift is a facelift is a facelift. Mm-hmm. But people will start calling it the S lift, the this lift, the Q lift, the up lift, the Mac lift. They got all these names for the same shit that everybody does, but they want their name associated so they get the notoriety. A ponytail lift, I think, and there are variations of what people call it, is a popular procedure that now they're attributing to, I think, Bella Hadid or one of these Hadid girls whose eyebrows are lifted, and like she did this thing where it's like you can pull back and as if you're wearing a ponytail and pulls back. I may be misquoting it, and whoever's listening who's the ponytail lift expert may be mortified. But to me, it's all the same caca. I just look at it very simply. You come in and I look at your eyebrows, your eyelids, and your face. And when any of those things have begun to, there's two reasons to do a surgery. One is what you had has no longer there and now it's changed. Or the other is what you're born with and hasn't changed isn't nice. So one is when I was younger, my eyebrows were in such nice position. Now I'm older and they've sagged. And the other is I'm not necessarily all that old, but I just don't like the shape of my eyebrows. In either of those instances, the goal is to create beauty and harmony. So whether it's because your eyebrows were just born that way or because your eyebrows have sagged, the bottom line is a nicely arched brow in a woman looks attractive. So I fix things according to what people need based on them looking great. And I don't give it any particular names. Brow lift, eyelid blepharoplasty, facelift. It's all the stuff that we've been doing for 50, 60 years.
Good. Well, I think we should take a break but there's two questions that are coming up. One is on HA butt fillers. And the other question is regarding COVID, which is, does daily use of a mask or N95 affect rhinoplasty results? So
all right,
we should talk about that when we come back, right?
All right, so check it out. We'll be back. Don't go anywhere. All right, guys, welcome back to the second half of this episode of Q&As. So I'm here with Maria, my producer, and she has got a whole bunch of questions that you guys have written in, and we're just kind of knocking them out and answering them for you. So what's the next one again, Maria? It was something about...
I want you to know this is my favorite. These are some of my favorite episodes because I get to learn all these little things that everybody asks me about.
All right. Well, then when you're at the party and they're like, Maria, don't you produce some plastic surgery?
Exactly. And of course I tell them.
Yeah. And I know what's up.
And then what I do is I share with them your episode so that they can hear.
All right. I like that. That's good. That's a good producer.
Okay. So Kiara NV says, would be interesting to know about HA butt fillers.
Okay. So what it is HA refers to hyaluronic acid. Hyaluronic acid is a general term for fillers that are made of hyaluronic acid. So Juvederm, Restylane, Voluma, it's a category or a type of filler. It happens to be the most common type of filler, and in my opinion, the best type of filler because it has the following benefits. Number one, it doesn't need allergy testing. HA, hyaluronic acid, is in your own body. You have it. It's all over your cells. So when they make HA from bacteria and we use it, it's compatible with the HA we have, so you don't get an allergic reaction like collagen that they used to get from horses and then required collagen testing. You literally can open a syringe and inject someone and not worry that they're going to react to it because it's in you. The second reason I like HA is it's temporary. Your body will break down the HA like it does in your own body, and you won't be stuck with it. Now that has a downside, which means the HA will go away even if you like it and you wish it didn't go away. But the good news is that you won't be stuck with it. And the third reason I like HA is that if you hate it, you can reverse it, and you are able to use an enzyme to inject to make the HA go away faster than it would on its own. So it's a very desirable product to inject in general. Now, the problem is that you have it in limited amounts, and any type of buttock enhancement requires a lot of volume. So, Maria, you come to me and say, hey, you know what I'm thinking? I want to make my lips a little bigger. I can make your lips bigger with very little volume because your lips are small and tiny space, and a little bit of volume, 1 to 2 cc's, will make your lips look very big. You come to me and say, hey, you know what? I want to make my butt larger. I need hundreds of cc's because it's a very big area. And for it to make a difference, I need hundreds of cc's. The problem is using HA, which comes in 1 cc syringes, it's prohibitively expensive. I need to inject 50 syringes into your butt for you to be like, wow, that looks better. And then it all is temporary. So I don't see HA as a great product for in the butt because it will go away. Now, people are using a product. So what do most people use? Fat. They borrow fat from their bodies. You and I have done 100 topics on BBLs, Brazilian butt lifts, which is fat transfer to the butt from other areas. People know my opinions on that. The other thing that you can inject, which is common now, is something called Sculptra. And Sculptra is better than HA in that you don't need as much of it in the body, generate some kind of collagen around it, etc. But I wouldn't use HA.
Okay. Now, Megan 10 Murphy asks, does a daily use of a mask or N95 affect new rhinoplasty results?
So the question is, all right, I had my rhinoplasty. Now I'm wearing an N95 or one of these masks is going to affect my nose. The answer is it depends. If your nose is healed, and by healed we'll tell you what that means, then no, a mask shouldn't affect your nose. I wear glasses on my face all the time. My nose I don't wake up 2 days later and my nose is moved or shifted. This is healed. Now, if I wore something on my nose constantly that put pressure, I could kill the skin, but it's not going to change the shape of my nose. That being said, if your nose is just recently out of a cast and it's still healing and the bones are malleable or mobile, then absolutely wearing glasses or a mask is going to make an impact. I don't allow my patients to wear sunglasses for 8 weeks after a rhinoplasty because these bones have been manipulated and they're soft. And I don't want them wearing a pair of glasses on here and denting this. So a mask is going to be the same way. But if your nose is fully healed and it's like 6 months out, it shouldn't make any difference once you're fully healed.
Great. Okay, this question I really like because this applies to me too. Hilda A. Shuri, I'm not ready for neck lift yet. Do you recommend alt therapy or profound procedure? I have the little.
Yeah. So what you're referring to is the classic question, which is I'm the watershed, which is I'm not there yet, but I don't like what's going on. So what do I do in the meantime? My belly is not that bad. I'm not ready for a tummy tuck. What do I do in the meantime? My breasts are starting to lose volume and sag, but I'm not ready for a breast lift and implant. Same thing as with the neck. The fact of the matter is that in general, most of the intermediate or interim procedures do not work well. Just make that a general rule of thumb. Usually these intermediate procedures are average at best. I have the L-therapy machine. I have it in my office and it works okay. And it works okay in the right patients and it does a little bit. But most people say they don't mind a little change, but almost everybody wants a dramatic change. Everybody wants the thing gone. So if you're starting to get a little turkey neck and you don't like it, you can do the L-therapy and it will help you a little bit. But it's unlikely to give you that look that I think most people think they want. And so I would just tell you to make sure that you recognize. The second thing is the majority of the procedures that are minimally invasive are full of shit. And you waste a ton of money and you don't get any improvement and you wasted money. Not to mention the fact that some procedures, let's just say Kybella will loosen your skin more than it already is. And so not only will it not help you, in my opinion, it will make you faster and more accelerated. I have done a neck lift in a 38-year-old because she had several rounds of Kybella and had hanging skin here. Is that crazy? Like what? She would never have needed that neck lift. So I would caution you in terms of that. I would say to you, you're better off doing a small neck lift earlier on, even if you're 40s, than to do some Mickey Mouse procedure and keep band-aiding this thing, never happy, never nice, always looking mediocre, and then at the end up having to do what you should have done 5 years ago. Now you wasted a ton of money. I'm a do it right and get it right, done right kind of person. And I think that if it's too good to be true, it's not true. If there was a machine that did it, Maria, I'd have 14 of those machines. I would never operate again. I just let people come into the office. I'd hire 10 nurses and they just run the machines. What do I need to go into operating?
And when you put the creams and massage your neck, that doesn't help
bullshit.
Protect it eventually?
No. Most of your outcome is genetically based. Second thing is gaining and losing weight. Third thing is like things like smoking and things like that. But generally speaking, a woman who's got an amazing neck at 50 is predisposed, and a woman who's got a terrible neck at 29 is predisposed.
Yeah. Well, here's one question, which I think is kind of bizarre. Can you do a tummy tuck and a rhinoplasty at the same time? This is from P3R3 Zima.
P3R3 Zima. So the question is, can you do a tummy tuck and a rhinoplasty? And the answer is absolutely. So I do combination surgeries. Probably 40% of my work is combination. What does that mean? People come in and they say, listen, these are the things that I'm thinking of doing. I don't really like my ears. They're quite large. I think my eyelids have a little extra skin and my breasts are sagging. Right? Let's do it. So what prevents you from doing let's talk about what the benefits of doing multiple procedures. The benefits are you recover once. So I want you to know that any surgery you do is inconvenient. Time off work, time off finances, recovery, pain, people can't see you, you can't go to your events. I mean, there's 100 reasons why surgery is a pain in the ass. So you want to do that experience once. You don't want to do your nose and then 6 months later go through the whole process again and do your belly. So in general, it's ideal to do as many things as you can together to get it over with. The reason not to do them together is two reasons. One is they get in the way of each other. So for example, I'm going to do something to the front of your body and something to the back of your body so that the healing is going to be compromised. One of them is going to be compromised. So if I'm doing everything in the front of your body, your breast, your nose, and your eyelids, I'm fine with that. But if I'm going to have to, I'm just going to say, let's say Brazilian butt lift, I put fat in your butt and then I do your tummy tuck and then you're recovering. Technically, you should not be laying on your butt for the fat to survive, but you can't lay on your stomach because you just had a tummy tuck. That's one reason not to do things together. The other is to just too many of them and it's unsafe. So you just can't do like 14 hours of surgery because you want to do 14 hours of surgery. So there's a certain amount of surgery that you can't get past, and that's between you and your surgeon.
And wouldn't that be like wear the surgeon out? I mean, would you want to?
No. I mean, the problem is each surgeon is different. Know that when you do multiple procedures, most surgeons will cut corners. And so they do is they get people to come assist them and help close. So you got to make sure that your surgeon, if he's going to do multiple procedures on you, you got to make sure he doesn't cut corners and bring other people in. That's why I always tell people the only thing I can do are the things that I can do. So if, say for example, occasionally I have patients say, I want to have a mommy makeover and do my nose at the same time. That's a breast lift and an implant and a tummy tuck and a rhinoplasty. And I say, can't do it. Well, why not? Well, because by the time I'm done doing your breast lift and implant and your tummy tuck, it's been 8 hours and I'm tired and I can't do your nose. But the other guy said he could. Yeah, I know. He's going to do a shitty breast aug with lift and a crappy tummy tuck, and he's going to slam the nose into the case. So you know that you can get things done. You just do them in a rush and get someone to close the stomach while you're doing the nose. So the answer is it just depends on the surgeon.
Okay, the last two questions.
Last two questions. Here we go, guys. Pay attention.
Myra Isabel. How far in the future do you see any of these procedures being fully covered by insurance?
So the question is, how far in the future do you see these procedures being covered by insurance?
Never.
I would tell you that as time goes on, fewer and fewer things will be covered by insurance. So now we have to be very clear what we're talking about. We're talking about medically necessary surgeries versus cosmetic surgeries. Mm-hmm. Never were and never will cosmetic surgery be covered because it just doesn't make sense. You pay insurance and then all of a sudden you go and get a facelift. Like no one's gonna ever pay for that. That doesn't even make any financial or economic sense.
But something like diastasis recti.
So I'm getting there.
Yeah.
So cosmetics never got paid, nor will it ever. And then where we're having issues is the area of medically necessary. So that pool of procedures is getting smaller and smaller and smaller because insurance companies are getting greedier and greedier and greedier, and insurance companies are saying certain things are no longer medically necessary. So what are the things that are considered as kind of on both fronts, cosmetic and functionally necessary? Historically, it was your upper eyelids, right? If your eyelids become so excess that you can't see, you could get your eyelids done, and then you would say that that was done because you couldn't see. Your septum, because you couldn't breathe, so you'd squeeze in a rhinoplasty. Your large breasts, you could go get a breast reduction because your back and neck are hurting. And your belly, because it has hanging skin, and you call that a pannus. But now, let's say 20 years ago was easy. You walked into your doctor's office and you said, hey, I can't breathe. And they said, oh, like looked in your nose and like, oh, you have a deviated septum. And boom, next thing you know, next week you were on the schedule and they did your deviated septum. And while you were there, they did your rhinoplasty to make it cosmetically pretty. And they charge your insurance and they just manipulated the insurance and paid for the whole thing through there. So you got a free rhinoplasty with your septum. Those days are so long gone because a lot of physicians, a small percentage of physicians abuse the system, and insurance companies are like, F that. And so now when you want to go get your septum done, they're very strict about making sure it's medically necessary, and then they didn't deny it, and then when they pay for it, they barely pay for it. So I would tell you the answer is, as time goes on, more and more stuff is going to be cash paid, and more things are going to be covered by insurance are going to be like major heart transplants, ruptured appendix, just major things.
Yeah. Okay, and our last question. Can a tummy tuck remove deep stretch marks that are low in the abdomen above the groin?
So can a tummy tuck remove stretch marks? That's essentially the question. The answer is yes and no. A tummy tuck can remove
all the stretch marks that will be located in the flap of skin that's thrown away. So if you're one of those people who is unlucky and your stretch marks are located high in your abdomen, near your belly button, up high, the bad news is that it'll never going to go away. The good news is that that skin will probably move down to a lower part of your abdomen. If you're the lucky type of person where the top of your abdomen is really nice and great skin, but you have all this loose, crepey skin that's stretched out on the bottom and you get a tummy tuck, and that skin gets removed, then the stretch marks will go along with it and you're probably left with almost no stretch marks. So it all depends on where the stretch marks are located. But the good news is the majority of stretch marks are most often removed. Great.
How's that?
I think that was good. I think we got our dosage of
Q&A. Okay, I like that.
And for next time, people should send questions so that
guys send in questions. So you know what they do is when I do the Instagram live, oh my God, thousands and thousands of questions. People love to be present and talk. This pre-recorded stuff, they're a little less, they're a little more gun shy, but pleasure doing it anyways.
Yeah. Okay, well.
All right, guys, join us at the next episode of Plastic Surgery Uncensored. I'm sure it's going to be something exciting and interesting and worthy of tuning in. See you guys next time.